Hey everyone, my name's Josiah,
My name is Arya.
and we're back with some more videos. And for this week, we're going to start a new series just going through some cases that we think are interesting and highlighting some topics. Um, so, if you saw our last video on breaking down chest x rays, that's a good intro, but we'll be covering some other different imaging modalities as well. So, let's get into it. So our first case for this week, our patient came in and they were complaining of abdominal pain. The setting was inpatient, so it means that this patient was already in the hospital for some reason. We're not exactly sure why. The imaging study that came in was a CT of the abdomen with contrast. There's no prior imaging on this patient right now, so what we see is what we get. So go ahead and pause the video if you want and try and interpret the CT as best as you can, and then we'll go and discuss some of the pathology together. All right, so we're just going to highlight some of the key structures that you'll typically find in the CT to help orient ourselves. And as a general reminder, similar to the x-rays, when we're looking at a CT, our right and our left is flipped. So it's as if the patient's feet are pointing directly at us and the head is away from us. So on the right side of our patient's body, from the top, we have the liver. And right below that, that smaller structure is going to be our gallbladder. This vascular structure in the middle, that's the inferior vena cava, or the IVC for short. And then at the bottom of our patient, near the spinal column, is going to be both of the kidneys. Now, to our patient's left, at the top, we have our stomach. And then down a little bit lower to the patient's periphery is the spleen. And then this vascular structure near the center is a pretty important organ, and that's going to be our aorta. So all of this is in their normal spot, but what is the pathology that could explain this patient's abdominal pain? Well, the abnormality is going to be this free air that we see. So we see a number of free air, spots of free air, but we've highlighted some of those bigger portions here in red. So what's the diagnosis? It's going to be pneumoperitoneum, or just a fancy word for free air that's in the peritoneal cavity or the abdominal cavity. So typically this is going to be air that escaped from the bowel lumen, and it most often is a sign of bowel perforation. And this is almost always going to be a surgical emergency. So in most cases, as said, it indicates a hollow viscus or some sort of perforation of an abdominal organ, whether that's a perforated stomach ulcer or from a perforated diverticulitis, or some sort of bowel obstruction. If there's necrosis or death of bowel tissue, that can weaken the walls of the organ and make them more prone to rupture. So in this specific case, the pneumoperitoneum was in the setting of barotrauma. So what happened is this patient was under mechanical ventilation. So they're intubated and receiving ventilator support for life support. Not exactly sure, but one of those complications of receiving mechanical ventilation is the pressure. If it gets too great, it can cause the alveoli in the lung to swell and potentially rupture, and that will cause free air to leak into the surrounding tissues, and it can be a cause of pneumoperitoneum. So that's our key finding for this case, and I'll let Arya handle our second case.
All right. So I know we talked about chest X-rays in our last video. So this is going to be a bit of a throwback to that, with kind of more exploring some of those pathologies that we kind of touched on before. So let's get right into it. So in this case, you have a patient coming into the ED. They have acute abdominal pain. They have a little bit of chest pain too, and there's some rigidity. And when I say rigidity, I mean like it's not like a normal exam finding that you see of a normal patient. You know, in a healthy patient, usually their abdomen is soft when you press on it, but when it's rigid, it's really hard, it's really tough. So this is the patient that comes in, and we were to get a quick way of finding out the pathology. We get a chest X-ray, not quite as in depth as a CT in the previous study, but just a quick way to kind of get an understanding of things. So I'll give you a quick second to kind of look at some of the things we talked about before and see if you can identify what's been kind of going on. All right. So, like we mentioned in our last video, some of the basics of the chest x-rays we see here. We see the trachea here. This is our airway. You see the borders of the heart. And then kind of getting into the problem area, you see our diaphragm here. But what's weird about the diaphragm? Well, it's all this air underneath it. Seeing that air underneath the diaphragm is usually not a good sign in imaging. So let's kind of delve into what could be the causes of that. Well, in this case, it's another sign of pneumoperitoneum. In this case, for this patient, it was in the setting of diverticulitis. So what happens is when those bowel walls are just weakened from all that inflammation, after a while, it can cause them to essentially perforate or puncture through, and that can cause the free air going into the abdomen and can lead to things like infection and all kinds of bad things. And so chest x-rays are actually one of the most sensitive ways for looking at like free air underneath the diaphragm in the setting of pneumoperitoneum. So a quick way you can maybe diagnose these things. Just like we mentioned before, usually the management will include an emergent surgery just because the risk of mortality and morbidity is really high. One thing I do like to mention is that this kind of x-ray or KUB is kind of common for boards exams for step 2 or your surgery shelves in medical school, this free air. So it's something I would definitely try to commit to memory. It's pretty high yield topics to keep in mind. All right, we hope you guys enjoyed this video. We hope to do more, just kind of touching more cases for the future. So we hope you all have a great rest of your day and keep on learning.